President Donald Trump recently revealed in a Wall Street Journal interview that he takes 325 milligrams of aspirin daily, far higher than the standard low dose of 81 milligrams recommended for heart health. At 79, he credits it with keeping his blood nice and thin to avoid thick blood in his heart, a habit he's maintained for over 20 years despite his physician's advice for less. Trump explained, "They say aspirin is good for thinning out the blood, and I don't want thick blood pouring through my heart. I want nice, thin blood flowing through my heart. Does that make sense?" His doctor, Sean Barbabella, confirmed the 325 milligrams dose for cardiac prevention, but noted it causes visible bruising on his hands from handshaking, something Trump has covered with makeup. Experts warn this full adult dose offers no extra clot prevention over low-dose aspirin, but raises bleeding risks like stomach ulcers or hemorrhagic stroke, especially for older adults. USPSTF guidelines advise against routine aspirin for primary prevention in those 60 plus, as harms outweigh benefits unless high heart risk exists. Trump scans show arterial plaque but no prior events, and recent White House reports call his cardiovascular imaging normal. Doctors like those at Mayo Clinic say 81 milligrams is optimal, 325 milligrams is unnecessary and risky. Trump rejects lower doses, calling himself a bit superstitious. He also mentioned leg swelling from venous insufficiency, but skips compression socks and exercise, saying treadmills are dull. Aspirin, or acetylsalicylic acid, is a widely used nonsteroidal anti-inflammatory drug, NSAID, that relieves pain, reduces fever, and decreases inflammation. Low doses, such as 81 milligrams daily, prevent heart attacks and strokes by inhibiting platelet aggregation in high-risk individuals. Avoid in children due to Reye's syndrome risk and in those with bleeding disorders or ulcers, as it increases gastrointestinal bleeding. This is for informational purposes only, not medical advice. Always talk to your healthcare provider about aspirin use. Subscribe Project Health MD for medical buzz.